Thanks for joining me for another YouTube video. I'm Laura from Front Office Rocks, and I'm super glad you're here. I want to talk about the idea of why patients feel like we are treating them as a number and not as a person or as a patient. I thought about this in a conversation that I recently had with a friend of mine. This friend of mine is not in dental at all, and they talked about how they were going to a dental office that the dentist just sold their practice. I happen to know the dentist. The dentist sold their practice, and now there's a new dentist who owns it. The patient has been to the new practice 2 times now, and both times has not had an exam by the new dentist. Now, I have multiple things I want to say about that. First of all, there should be exams done. I think every time the patient comes in, at least every 6 months, maybe not every 3 or 4 months, but every 6 months. So there's an issue right there. I don't know how often this patient's going in, but still, they need to have exams. Second of all, this is that patient's first impression of the new dentist. So let me remind you again, the dentist sold the practice and the new dentist bought it. My friend has gone in as a patient and has not met the new dentist, has only seen the hygienist. Now, as a new patient or as a patient, I think it's vital that they meet the new dentist. You, as a new dentist, don't want to have the patients leaving, which they're probably going to do, and even more so when they're not even meeting the dentist. So I was completely shocked about that. And then thirdly, my thought behind this is patients, the number one complaint patients have about our dental offices as we grow is they used to feel like family and now they feel like a number. So we get so efficient and so busy and so trying to get production in that we've totally forgot that the patients want to be seen. They're paying the money, they're taking the energy, they're taking the time to come to the dentist. And if they feel like they're getting pushed in, pushed out, where they're just being seen quickly and left, the doctor doesn't even have time to come in and meet them, the doctor doesn't have time to do an exam, in their mind, what's the point of going, right? Now, I'm not saying that they're not getting good hygiene by going in and seeing our hygienist, but patients are paying money and want to feel like they're of value to your practice. So when I heard this story from a friend of mine, and unfortunately there's not much I can do or say about it, but it's just a shame because this patient is willing to stay with this practice if he felt like the new dentist cared about him and was good and he wanted to stay. He doesn't want to leave the practice. But he has yet to meet the dentist. And I know that there's a lot of practices where exams aren't done, doctors aren't going in, we're in a hurry, we're in a rush so much that we wonder why our patients don't come back for their regular cleanings. So my point in this video is to remind you the importance of doing exams. It's to make sure that our patients are stable and healthy. It's to remind your patients every time why they come to your practice. It's to take care of our patients and show them that you value them and that you care about them. So make sure that you're not cutting corners in lieu of efficiency and productivity, and really put the patients first each and every single time they're in the practice. Again, I'm Laura from Front Office Rocks. This is my YouTube channel. Please subscribe below. If you have a doctor that maybe has not been too good in this, give them this video. Let them reach out to me and talk to me about it because I have a lot of thoughts and ideas behind it. And share my channel with other dental professionals because I would love to keep this conversation going and remind everybody of the things that maybe we kind of forget over time. So again, thanks for joining me, and make sure you're getting in there and treating your patients like people and not like a number.